Walk us through how you're able to accomplish this.
Every part below Andy's eyes was replaced, including the nose, the jawbones, the upper jaw, lower jaw, the cheekbones, and his teeth. All of those were taken with everything overlying them, including what I mean is all the muscles and skin from in front of the ear, below the eyes, below the chin. All of that came from the donor. And it replaced, so we had to set up the recipient the same way. And then we had all the facial nerves that we needed to connect. And we mapped out all the facial nerve branches. We ended up connecting 7 branches on each side of the face from Andy's donor nerves, meaning the nerves that are providing the function to the face that was transplanted. You know, what really helped with the result is the guides that we use. We use virtual surgical planning, meaning that we were able to perform the surgery before the surgery was even started. So we knew exactly where the bones needed to be cut, and we knew exactly the angles they needed to be cut, so that when we put those guides in the surgery, we made those cuts both on the donor and on Andy, that the face, when it was transplanted over, it would fit perfectly. But it's the donor face and the generosity of the donor family is really what made the difference. I mean, it was a beautiful face of the donor, and the kindness of the family and their willingness to donate that face is really what brought it all to
and I think that is a wonderful takeaway, because we often talk about in this country the mismatch between people who need organs and a lack of donors. Obviously, we don't often talk about face transplants, but this is something that I suspect will become more and more common. Dr. Mardini, we often talk about how broken our healthcare system can be. I believe that you and your team is everything that's right with the American healthcare system, and we are so grateful to all of you for all of those Saturdays when you could have been with your families and at home, but you are doing this to advance not only medicine, but to give Andy the result that he deserved. Kudos to you and your team. And certainly I would be remiss if we didn't also send a thank you to Rudy's family. And Rudy, may he rest in peace. If you want more information about becoming an organ donor, we'll have resources on our website. We'll be right back.